Obsessive-Compulsive Disorder, OCD, represents one of the most misunderstood mental health conditions in contemporary society, affecting millions of individuals worldwide with its complex web of intrusive thoughts and repetitive behaviors. This debilitating psychiatric disorder transcends simple habits or preferences, manifesting as a chronic condition that significantly impacts daily functioning, relationships, and overall quality of life. The disorder's hallmark characteristics involve persistent, unwanted thoughts known as obsessions, coupled with repetitive behaviors or mental acts called compulsions that individuals feel driven to perform in response to these distressing thoughts. The neurobiological foundations of obsessive-compulsive disorder reveal intricate dysfunction within specific brain circuits, particularly involving the orbitofrontal cortex, anterior cingulate cortex, and caudate nucleus. These regions, collectively known as the cortico-striato-thalamo-cortical circuit, play crucial roles in decision-making, error detection, and behavioral control. When this circuit malfunctions, individuals experience difficulty filtering out irrelevant thoughts and struggle to feel satisfied that tasks have been completed adequately. Neurotransmitter imbalances, especially involving serotonin, dopamine, and glutamate systems, contribute to the persistent nature of obsessive thoughts and the compulsive urge to engage in repetitive behaviors. Research indicates that obsessive-compulsive disorder affects approximately 2 to 3% of the global population, with onset typically occurring during childhood, adolescence, or early adulthood. The disorder demonstrates no significant gender preference, though certain symptom subtypes may show slight variations between males and females. Genetic factors play a substantial role in OCD development, with studies revealing higher concordance rates among identical twins and increased prevalence within families. However, environmental factors, including stress, trauma, infections, and significant life changes, can trigger or exacerbate symptoms in genetically predisposed individuals. The phenomenology of obsessive-compulsive disorder encompasses diverse presentations, with symptoms often clustering around specific themes. Common obsessions include contamination fears, concerns about harm befalling oneself or others, need for symmetry or exactness, religious or moral scrupulosity, and intrusive sexual or violent thoughts. These obsessions generate intense anxiety, guilt, or discomfort, compelling individuals to engage in neutralizing behaviors. Corresponding compulsions might involve excessive hand-washing, checking behaviors, counting rituals, arranging objects in specific patterns, seeking reassurance, or performing mental rituals to counteract disturbing thoughts. The heterogeneous nature of obsessive-compulsive disorder has led researchers to identify several distinct subtypes based on symptom clusters. The contamination subtype involves fears of dirt, germs, or toxic substances, leading to excessive cleaning and avoidance behaviors. The harm subtype encompasses fears of causing injury to oneself or others, resulting in repeated checking of locks, appliances, or potential hazards. The symmetry subtype focuses on needs for order, balance, or exactness, manifesting as arranging, counting, or repeating behaviors until things feel just right. The forbidden thoughts subtype involves disturbing sexual, violent, or blasphemous obsessions, often accompanied by mental rituals or avoidance strategies. Diagnosis of obsessive-compulsive disorder requires careful clinical assessment, as symptoms can overlap with other psychiatric conditions or be mistaken for normal behaviors taken to extremes. Mental health professionals utilize structured diagnostic interviews and standardized rating scales to evaluate symptom severity and functional impairment. The diagnostic criteria specify that obsessions and compulsions must be time-consuming, cause significant distress, or interfere with normal functioning. Differential diagnosis becomes crucial, as OCD can coexist with depression, anxiety disorders, attention deficit hyperactivity disorder, or tic disorders. The impact of obsessive-compulsive disorder extends far beyond individual suffering, affecting families, academic performance, career prospects, and social relationships. Children with OCD may struggle academically due to perfectionism, excessive erasing, or inability to complete assignments within reasonable timeframes. Adults might experience workplace difficulties, relationship conflicts, or social isolation due to time-consuming rituals or avoidance behaviors. The disorder's secretive nature often delays help seeking, as individuals feel ashamed or embarrassed about their symptoms, leading to years of silent suffering. Treatment approaches for obsessive-compulsive disorder have evolved significantly, with evidence-based interventions demonstrating substantial efficacy in symptom reduction and functional improvement. Cognitive behavioral therapy, specifically exposure and response prevention (ERP), represents the gold standard psychological treatment. ERP involves gradual, systematic exposure to feared situations while preventing the performance of compulsive behaviors, allowing individuals to learn that anxiety naturally decreases without engaging in rituals. This approach requires considerable courage and commitment, but yields lasting benefits for many patients. Pharmacological interventions play a complementary role in OCD treatment, with selective serotonin reuptake inhibitors, SSRIs, serving as first-line medications. These medications, including fluoxetine, sertraline, and fluvoxamine, often require higher doses and longer treatment periods compared to depression treatment. Clomipramine, a tricyclic antidepressant with strong serotonin reuptake inhibition properties, represents an alternative option for treatment-resistant cases. Recent research explores novel pharmacological targets, including glutamate modulators and anti-inflammatory agents, offering hope for individuals who don't respond to traditional treatments. Innovative treatment modalities continue emerging for severe, treatment-resistant obsessive-compulsive disorder cases. Deep brain stimulation involves surgical implantation of electrodes in specific brain regions to modulate neural activity. Transcranial magnetic stimulation offers a non-invasive alternative, using magnetic fields to stimulate targeted brain areas. These interventions, while promising, require careful patient selection and comprehensive evaluation of risks and benefits. The societal understanding of obsessive-compulsive disorder has improved considerably, though misconceptions persist. Media portrayals often trivialize the condition, depicting OCD as quirky perfectionism or cleanliness preferences rather than acknowledging its debilitating nature. Education initiatives emphasize that OCD involves unwanted, distressing thoughts and behaviors that individuals cannot simply choose to stop. Reducing stigma remains crucial for encouraging help-seeking and promoting empathy toward those affected by this challenging condition. Recovery from obsessive-compulsive disorder requires comprehensive, individualized approaches that address both symptom management and quality of life improvement. Support groups provide valuable peer connections and practical coping strategies. Family education helps loved ones understand the disorder and learn supportive responses. Lifestyle modifications, including stress reduction techniques, regular exercise, and healthy sleep habits, complement professional treatment interventions. The future of obsessive-compulsive disorder research holds promise for enhanced understanding and treatment options. Advances in neuroimaging technology provide unprecedented insights into brain function alterations. Genetic research may identify specific risk factors and personalized treatment approaches. Digital therapeutics and smartphone applications offer accessible, scalable interventions for symptom monitoring and skill practice. Ultimately, obsessive-compulsive disorder represents a complex, multifaceted condition requiring compassionate, evidence-based care. While challenging to treat, many individuals achieve significant symptom reduction and improved functioning through appropriate interventions. Continued research, education, and advocacy efforts remain essential for supporting those affected by OCD and advancing our understanding of this intricate mental health condition. Recognition of OCD's true nature as a serious psychiatric disorder, rather than a personality quirk or character flaw, promotes effective treatment seeking and reduces the suffering experienced by millions of individuals worldwide.